Hey, welcome back, everybody. Listen, my special guest this segment is Dr. Stephen Edge, breast surgeon and vice president of healthcare outcomes at Roswell Park Comprehensive Cancer Center, here to talk about something that's so important, breast cancer, what it is and how treatment is determined. Nice to have you here, Dr. Edge.
Nice
Busy
to be back,
doctor
yeah.
over at Roswell. We're thrilled to get you for a few minutes. Let's talk about breast cancer. Is it one disease?
We usually think of breast cancer as breaking down into three major types based on certain things that are measured on every breast cancer. As soon as you have a biopsy, these things are measured. Those things are the estrogen receptor, the progesterone receptor, and something called HER2. Mm-hmm. And except for the so-called in situ cancers, which we're not really talking about right now, we break them down into three types of breast cancer. One is estrogen receptor positive and HER2 negative. We'd use the term luminal cancer for those. They look like the normal lumen of the milk duct. Mm-hmm. The HER2 positive cancers, which are actually, without appropriate treatment, the most aggressive kind. And then those cancers that don't have either the estrogen receptor, the progesterone receptor, or HER2, those three things, we call those triple negative. Now, those are probably the most aggressive and more common in young African American women.
Now, you might be saying, well, how do we get to that stage from just seeing something suspicious on a mammogram? Well, if a doctor sees something suspicious on a mammogram, they may ask for a biopsy, mm-hmm. and that biopsy then pinpoints that exact type and grade of cancer. Mm-hmm. So that's how you know what you have, and then you can go ahead and decide on a treatment that will be the most beneficial for you.
Right. Those three things, plus the type of cancer, whether it's gone to lymph nodes and the size, help us determine what the best treatment is. And you have to remember that the majority of women now with breast cancer are effectively treated. Mm-hmm. Even those who have lymph nodes involved, even those that have the most aggressive, the majority of women, by certainly not everyone, the majority of women are effectively treated.
Yes, they are. As a matter of fact, a timely mammogram, everyone, reduces a woman's risk of dying from breast cancer by 30 to 50%. So do not get a mammogram because you're concerned about it. It's something that could actually save your life. And there's nothing like being told you're absolutely fine. Yeah. But I'll tell you, if you go to Roswell and get your mammogram, which is a great idea, and you don't have to be a patient there, they have 3D mammography. They have a whole floor dedicated to taking a look at your films. And I will tell you, you feel like you're in very, very good hands, because if you do need that biopsy, that's something they can do right away and get right on top of it. And timely treatment makes all the difference in the world.
Absolutely. You know, the large majority of women are effectively treated and live out the rest of their natural life. All of us have friends who that's not been true for, but the majority of people have done very well.
Yeah, they have. Mm-hmm. We want to thank you for all the work that you and Dr. Irma Linda Bonaccio and all your doctors do over at Roswell.
We have a big team over there.
It's awesome. You're saving lives every day. And what we can do is just please go ahead and call Roswell. Make your appointment over there. Call your girlfriends. Call your mom. If you believe you even have a hereditary risk of it, go ahead and have your mammogram done and go and have it at Roswell. Because there's, like I say, there's nothing like hearing that you're absolutely fine. And if there is something, and if you're finding it early, they're going to cure it early, and that's all there is to it. It can be as easy as that. RoswellPark.org. Go online or give them a call and make your appointment today at 1-800-ROSWELL.